But while our numbers remain stable, we're not seeing the decline in metrics that we'd like to see. This tells us that the pandemic is not over.
We are into our first hour of eased mask mandates as Governor Roy Cooper says our trends are doing better, but they're still not where they want them to be. For the next 10 minutes, we're going to dig into the newest executive order and how it impacts you, whether you're vaccinated or if you're not. Let's begin with what is changing. The biggest change is wearing masks outside. Masks are no longer required in outdoor settings, but the state still recommends you wear a mask outside if you're in a crowded area or anywhere social distancing is hard. Masks are still required inside, though. Another notable change, more people can gather. The indoor mass gathering limit has increased from 50 to 100 people, and the outdoor is up to 200 maximum. All occupancy limits are still in place. We spoke with people who say they are ready for a sense of normalcy.
It'll be nice for people to be able to get out and walk around without masks.
I'm ready to look people in the eye and ready to smile at people and, have conversation.
I think mentally people just kind of need to, get back to normal.
The changes will affect athletes as well. Under this new order, professional and collegiate athletes will not have to wear a mask inside or outside during plays or workouts. The exception to this rule is when a player is on the sidelines or not actively running a drill or a play. Changes also apply to younger kids who may be playing outside during recess or gym class. The new orders say students should still wear their mask during playtime if kids are inside. The athlete and recess rules only apply to athletes and kids. If you are exercising inside, you still need to wear your mask. The only exceptions to this rule include medical issues like trouble breathing or if you get dizzy or lightheaded. It also applies to athletes wearing a mouth guard or a helmet, or if the athlete is performing in a way that the mask could get tangled or block their eyesight, like cheerleading, gymnastics, or tumbling. The exception also applies to activities where the mask could get wet, like swimming. But again, you still need to wear it if you are exercising inside. People who are not fully vaccinated should still wear their face coverings outside if they can't stay 6 feet apart from anyone, if those people don't live in their house. Remember, just because the mandates have been eased, you can still get sick, especially if you're not vaccinated. Health leaders want you to take precautions to protect yourself. Being fully vaccinated means you are 2 weeks out from your second dose. That's the amount of time health officials say it takes for our bodies to produce antibodies after getting the vaccine. The governor's new orders follow the CDC's new guidance on masks and outdoors. President Joe Biden addressed these changes earlier this week.
If you're in a crowd, like a stadium or at a conference or a concert, you still need to wear a mask, even if you're outside. The bottom line is clear. If you're vaccinated, you can do more things more safely, both outdoors as well as indoors. So for those who haven't gotten their vaccination yet, especially if you're younger or think you don't need it, this is another great reason to go get vaccinated. Now.
Health leaders suggest anyone who is not vaccinated wear their mask when they're around people who they don't live with. People who are vaccinated can go without their mask when they're outside or with other fully vaccinated people. But what if you're vaccinated and someone you want to see is not? Can you get them the virus even if you aren't sick? Health officials say it's possible.
Our sources, 2 infectious disease doctors, Dr. Sarah George with St. Louis University School of Medicine and Dr. Alex Lacasse with SSM Health St. Mary's Hospital. Our question, is it true a fully vaccinated person can spread COVID-19 to an unvaccinated person? Doctors say if you're vaccinated and then significantly exposed to a person sick with COVID, you can inhale the virus and it could live in your nose. That won't get you sick, but it could make you a carrier of the virus.
After that, you leave that room and you go in another room with somebody that has not had the vaccine. And you talk loud and you cough once in a while or you sneeze. Then for that particular person, you just put them at risk now because what's in your nose now has been, aerosolized
Both doctors agree the chances of this happening are low. And Dr. George says early studies out of Israel show the vaccine should partially protect you from having the virus replicate in your nose, making you less likely to spread COVID.
If you're vaccinated, you're at lower risk probably for transmitting to other people. How much lower, we just don't know yet.
But we can verify this is true. There is a chance a fully vaccinated person could spread COVID-19 to an unvaccinated person. Both doctors say that's why the CDC guideline says if you are around unvaccinated people, you still need to wear a mask and keep your distance.
I get it. This is a lot of information to listen to, when to wear the mask and whatnot. So the CDC put together this helpful chart to allow us to understand when we should and when we should not be wearing our mask. Unvaccinated people can ditch the mask if they're walking, running, or biking outside with people who they live with, or if they're at a small outdoor gathering with fully vaccinated family and friends. But any other time, it is safer to put your mask back on. Fully vaccinated people have a lot more leeway, only needing their mask at crowded outdoor events like a parade, a concert, or a sporting event. But if you're inside, no matter if you're vaccinated or not, you still need your mask for now. Here's another reason you may want to keep your mask handy when you're outside, even if you're fully vaccinated. It could help your allergies. The CDC says masks can also stop us from inhaling allergens. Dr. Priest from Novant Health agrees this is a possibility.
Individuals who wear a mask are going to be more protected from tree or grass or pollen.
Dr. Priest explains that masks have also helped keep seasonal flu numbers down. He says we've seen some of the lowest flu numbers in a while. Masks are not foolproof though, and some smaller allergens could still slip through the material. So make sure you're still taking your medicines and washing your mask to get rid of any pollen. State leaders have said they want 2/3 of all adults to be vaccinated by June 1st in order to ease most of our mask restrictions. But what's the significance of that number, 2/3? Dr. Mandy Cohen explains how leaders reach that number.
We chose a 2/3 goal in consultation with our public health experts and really believe that with 2/3 at least partially vaccinated, we know a couple things. First, most folks who have gotten their first vaccine are on their way to getting their second. 90% or more of folks who come for their first shot get their second. So that's how we landed on partially vaccinated.
Dr. Cohen adds the 2/3 goal will protect communities enough for us to live with the virus safely. That 2/3 goal is set for easing the mask mandates even more. Social distancing, capacity limits, and mass gatherings restrictions could be a thing of the past come June if we all do our part for the next month to help lower those COVID numbers. But Dr. Cohen says the mask mandate won't change come June 1st. If you're still on the fence about getting the vaccine, you may want to try talking to someone you trust about your concerns. You're going to hear more about restrictions and the eased mask mandates coming up next on WFMY News 2 at 6.